Hi, I'm Dr. Alex Azadi, founder of Balance Within, here located in Encino. And today I wanted to talk to you about something that many of us seem to be battling, whether it's at one point or another in our life, and that is sciatica. If you're generally having a pain that's radiating down your leg, whether it's the left side or the right side, and it consists of numbness and tingling and maybe going even into the toes, and you may even feel a little bit of paralysis in your toes, not being able to move your toes the way you'd like, or no, toes or feet that are completely numb, and it's starting almost at your lower back or in your buttocks and moving down your leg. That could be something labeled as sciatica. It doesn't necessarily have to be. There are many things that it can be, like piriformis syndrome, or tight hip flexors, or a bulging disc that may be causing the similar signs and symptoms. But one term that we're fairly all familiar with is sciatica. Now, sciatica can be really concerning. It can be very scary for some people because the pain can be very intense. It could be a 10 out of 10, to where you can't move, you can't get out of bed, you can't get off the couch. You may even be stuck in one certain position, and that can be very frightening. But don't let that scare you. In most cases, you do heal when proper modalities and proper healing techniques are put in place. If you find yourself in this kind of pain, and you call your doctor and go to your doctor, usually 9 times out of 10, they're going to give you some sort of medication, whether it's an anti-inflammatory, muscle relaxer, in some cases a steroid. And then they may prescribe you a musculoskeletal treatment method like either physical therapy, chiropractic care. In very, very rare cases, if you have a great doctor and your doctor is familiar with many different types of modalities, that doctor may prescribe you treatments of acupuncture. In any case, if your doctor does do that, I would stick with that doctor. That doctor is very well informed and very well educated. And I would actually like to meet that person. A lot of the times when we do go do these other modalities, when we're prescribed from our MD, whether it's PT, physical therapy, or chiropractic care, sometimes they don't work. Sometimes you take the medication and you do the rehab exercises that you get from your PT, and you do the treatments 2 or 3 times a week with a chiropractor, and your improvement is, 20% at best, or maybe even nothing. And in some rare cases, maybe you get even worse, to where that burning sensation, that shooting sensation down the leg, intensifies. Well, these are cases where chiropractic or PT may have not been the best alternative treatment for you, because they may be irritating the issue. And unfortunately, you either don't get better or you find yourself even getting worse. What do? You tell yourself, oh my God, I'm doing the diet that my doctor told me, I'm taking the medication, I'm doing all these things, I'm stretching, I'm exercising, I'm meditating, I'm keeping my stress low, but nothing seems to be working. Well, that's really where acupuncture comes in. Unfortunately, it is kind of down the line on the totem pole. It's not the first thing that doctors will refer patients out to, and it's not the first thing that injured people think of when they get injured. Um, and that's okay. It's just not hasn't been incorporated into our medical system the way PT or chiropractic or a traditional doctor has been. We are more conditioned to try all these other alternative choices, and when nothing tends to work, your last resort is usually traditional Eastern medicine or traditional Chinese medicine, which is acupuncture and everything else under that umbrella. In that injured area, you are going to have inflammation of fluids, inflammation of red blood cells, white blood cells, and that inflammation itself can also cause a lot of the irritation and pain that you're feeling. So one thing that acupuncture has been shown to do is directly affect the inflammatory process. So it gets that inflammation as soon as we put in and start the acupuncture treatment, it gets that inflammation process to subside and to decrease. and increasing circulation through that area, increasing blood, increasing oxygen, increasing something known as qi by Chinese medicine into that area, and that circulation causes that inflammation to subside. So that right there, within a few minutes of your treatment, most of the time, excuse me, you will begin to see results. You will begin to get relief right off the bat. Along with that, acupuncture helps your own body begin to heal itself. So once we target the specific injured area and we see what's going on and what could be causing the pain levels and what can be causing the tight glutes or the sciatica or the tight hip flexors, and we begin the treatment in that area, the acupuncture will boost your body's ability to help heal itself. It's really being used, the acupuncture is being used as an aid to help your body heal. And that's one of the strengths of acupuncture. All these different modalities are amazing. I'm not going to knock any other modality. Every modality has its place, but so does acupuncture. And one of the areas that acupuncture thrives is in this section of getting inflammation to decrease while helping your body's circulation. Those two in combination are very strong, especially if they're combined with Western pharmaceuticals, whether your doctor has you on a muscle relaxer or gabapentin or whatever it may be. When you incorporate these two, your healing process becomes much quicker, it becomes much more efficient, and you heal better and keep that injury away longer. I hope this information has helped. If you have any questions, any concerns, please feel free to reach out to us. If you've liked the information, please like and subscribe to our channel. And there's a link at the bottom if you wanted to make an appointment for a consultation or a treatment. Thank you, and see you next time.